Hello guys, welcome back to my channel. Thank you so much guys for joining me once again in this video. If you are new here, my name is Neseki, and on this channel guys we talk about nursing and lifestyle. To my subscribers, thank you so much guys for coming back. You know I love you so much. If you haven't subscribed yet, please go ahead and do so. Just hit that subscribe button to join this family, then we are good to go guys. We all know guys that we are in that season again, in that time again where we wait in anticipation for this May 2024 nursing intake bid, general nursing or primary care nursing. We are waiting for the ministry to advertise this May intake. But you know what, I've been receiving a lot of questions guys in all those different videos that I've been uploading about nursing, been compiling all these questions, and I'm going to answer all those questions in today's video. And I have the questions in this book guys, so I will be answering all of your questions today in today's video. I know a lot of people want to be nurses and they want to join this unique profession, but you don't even know how, even sure of what to expect. But in today's video guys, I'm going to make you comfortable. I want to make you comfortable of yourself. You have to know what you really want to become. So don't worry, after this video guys, you will be comfortable and you will be very comfortable and you'll be sure of yourself. What you can do, just make sure that you watch this video up to the end. Okay, so without wasting time, let's just get into the video. First of all, we want to define what a student nurse is, because we want to be student nurses. You can't be a nurse without getting into training. So we are going to define what a student nurse is. A student nurse, in simpler terms, is just that person who is training to become a nurse, either at a hospital or a nursing training school. Question number 1: how to become a student nurse in Zimbabwe? Obviously, you have to apply either online or writing the application letter and submit it or post it. It all depends with the requirements of that particular intake. Like for January, the previous intake, the January 2024 intake, but as from people were writing application letters and submit them to the responsible authorities. As from 2022 going back, people were applying online. Certain requirements that are needed when you're applying, be it registered general nursing or primary care nursing. For registered general nursing, you're supposed to be between the age of 18 to 30 years by the date you start your training. Then you need to have one sitting. 5 O-levels, 1 sitting. The subjects that includes maths, English, science, and any other 2 subjects. As for primary care nursing, at least 2 sittings, 5 O-levels, English, science, maths, and any other 2. Then for age, you are supposed to be between 18 to 45 years by the date of commencing your training. Do you understand? The second question is, how long is the nursing training in Zimbabwe? It all depends guys with the course that you are doing. If you are training for the registered general nursing diploma, is 3 years, and if it's for the degree in registered general nursing, it's 4 years, and for primary care nursing certificate is 2 years. Going on to the third question: do student nurses pay their school fees during training? The answer to this question, yes and no. I'm saying yes guys, because if you are training at a hospital or a government institution, like those who train for a registered general nursing at a hospital, they don't pay school fees. be it general nursing or primary care nursing, you don't pay school fees. But if you are training at a private institution or a university, you are going to pay your school fees. Question number 4, do students get paid during their training in Zimbabwe? It's yes and no. Just as the above question, guys, if you are training, if you are a government student, if you are a government training student, you are going to be paid during your training. But if you are a private or if you are training at a university, definitely you're not going to get any pay. Understand? Do you understand? Do you understand? Okay, and the next question 5. When is the ministry going to advertise the May intake? Okay, guys, with this question, usually I've been observing, it's just an observation that I have made, guys. Usually they advertise just a month before the intake. But as for January intake, guys, they actually advertise some few weeks before, or few days, where they few weeks, 2 weeks or so, if I'm not mistaken. They were just a few weeks before the actual month year intake, the January intake. So you just be watchful, guys, and as from now, just keep your ears open and look out for that advertisement. As we always say, in nursing, most of the things are subject to change. Things might change, guys. Then the next question, what are the challenges did you face at nursing training school? Maybe this question was specifically directed to me, but I'm going to answer this question in general. Okay, there are so many challenges, guys, that you face at school in general, be it you are doing a degree. What's going on? There are so many challenges, guys, that you can face at school, be it you're training, what you're doing, engineering, you're doing doctorate, you're doing whatever the course you're doing. There are so many challenges that you can face as a student because you will be under pressure, guys. But specifically for nursing is one of those challenging courses that I have seen in my life, guys. It's so challenging because there is a lot that you do at school within a short period of time, especially those who are training for a diploma in general nursing or in primary care nursing. The time, as for me, I just feel it's so limited. 3 years are not even enough because there is a lot of things that you do. Remember, you'll be learning about this human body, guys, the anatomy and physiology of the human body, the conditions, the management of these conditions. I just feel there is a lot of rushing, too much pressure, too much work within that short period of time when you will be in class, when you'll be in block. Then you are expected to do a lot of researching. You're supposed to do assignments, you're supposed to study. There is a lot. If you have a family, there will be a lot of things on you during that period of time, that period of training. Then from block, you are going to the clinical area where you will be meeting new things, new challenges. You will be meeting there in the clinical area. Of course, you'll be trying to apply those things that you have learned in class. But guys, applying the theory to the practical, the real thing, the real person, there's a lot, guys, through. There is a lot that you go through trying to adjust yourself from what you have learned on paper to the real person. It involves a lot, guys. As for me, I was so under pressure, guys. I don't want to lie. I was so under pressure. It takes me a lot to adjust, to cope with the pressure that I was having during that time, considering that I was just coming from school. I was just coming from school, guys, and that's not, it's another course in life, or Tombofamba, of course I did some one or two things during that time when I was waiting for my chance, but it wasn't much, and I had never experienced such pressure, in class, such pressure in class, such pressure in the practical area. It was a lot as for me. Then the next question, let's go to the next question. That is question number 7. How do you balance your social life and schoolwork during training, nursing training in Zimbabwe? To tell you the truth, guys, let me just say this. It's so difficult. Whether you like it or not, guys, what I have seen, what I have realized is that when you join this nursing profession, the other part of your social life, guys, tends to disappear. It just goes. I don't know why. Because most of the time you will be in the ward. Because there is no special holiday in nursing. During that Christmas holiday, Christmas period, that Christmas season, for example, nurses will be in the ward. During those special family gatherings, outings, nurses, there will be a nurse in the ward. Even whether it's a national event or what, be it elections, be it celebrations, nurses will be in the ward. Saka, you need to be prepared for that. But with that being said, you need to find time on your own. You need to find time to cover up for these moments that you are in for these moments that you will be in the wards, for the benefits of your family and yourself as well. Sometimes it's a bit painful when you leave your kids most of the time alone, your kids, your spouse alone, maybe in the hands of the maid, or in the hands of the house helper, or even relatives, because most of the time you will be in the wards, most of the time you'll be at work. So for you to balance this, you need to spare, maybe to find time to be with your family, to be with your kids. That time that you are off, you need to prioritize your family. You need to prioritize your social life. That small time that you get, you need to prioritize your self-care, your family. Just try by all means to utilize that moment to cover up for all those hours that you spend at work. You need to try to cover up for that. It's painful though, just to give up your social life for the nursing service. That's why it is said to be a profession for those who have been called for. Get me right. I hope I have answered this question wholly, truthfully. Truthfully. Then the next question: is nursing training difficult, and why? Yes, nursing training is so difficult, guys. Akutambiwe kuti nurse, guys. There's a lot of pressure. There's a lot of pressure. Learning human body, learning this. Because, guys, you in medicine, medically, you'll be dealing with human body. That's why it's difficult. You are dealing with human life. You are dealing with the real things. And the purpose is to save life. Saving somebody's life. So it's something that is difficult. Like, if we can refer back to something that we all know, the COVID pandemic. The COVID came, guys, ravaging, killing people. And the scientists were so busy, very busy trying to find out what can we do to save people's lives. And in the wards, there were nurses. During that time, guys, when you were saying stay at home, the time when everyone was at home, trying to protect themselves, everyone was keeping themselves safe from contracting this COVID-19 disease virus. And during that moment, those essential workers except no one is allowed to move around except the essential workers. Nurses were the essential workers. Doctors were essential workers. The pharmacists, all those people who works in the hospital, within the hospital premises, those were the essential workers, and they were in the wards. It's not that there's something that they were given. They were given to protect themselves from the COVID-19. They were also being vaccinated like everyone else, but there was nothing that was given to their immunity to protect themselves. Most of the nurses, they get sick, some died in the name of nursing service, saving other people, dying trying to save other people's lives. And most of the people, some families, vana dzitori nherera vakasara dziri nherera, baba namai zvichida vakafa, mai vakafa mucovid, baba vakafa mucovid, vakaita covid vari pabasa vakafa. That's how difficult nursing is. It doesn't matter kuti kune zvirwere zvipi zviri kumhanya very fast zvichiaffecta vanhu very fast. That same nurse, that same father, that same mother who is a nurse will be in the wards with the patients, with the people who have contracted that disease iri kumhanya iyoyo. That's how difficult nursing is. It's so painful. Yakanaka, zvakanaka kana vanhu vachingorwara zviri normal. But when it comes to disasters, that's when you see that nursing is not a joke. Being a doctor is not a joke. Being a physiotherapist is not a joke. Being a lab scientist is not a joke, guys. Especially nurses. Nurses will be in the wards 24/7. That's how difficult this unique profession is. So painful. Anyway, zvakadaro kuna Mwari anochengeta. Musatye kuita manesi, kuna Mwari anochengeta. The last question, not least, the last question, what are the duties for student nurses? What are the duties for student nurses here in Zimbabwe? Anyway, the duties for student nurses in all over. They usually depend with the level of your nursing training. If you are just starting the PTS, the first years, taking of observations, nursing care, bathing patients, offering of urinals and bedpans, feeding, you'll be in the feeding of patients, all that you'll be doing that. And level you'll be giving drugs, the medication, medications, you'll be doing some procedures like wound care, IV, giving a lot. You'll be doing a lot depending with the level you are in. And don't worry about the clinical side, guys. You always work under supervision of your clinical instructors. There will be senior nurses there, senior student nurses, senior nurses, assistant in charges, the matrons, even the doctors. Remember, you always work under the supervision of your clinical instructors or the senior nurses in that particular environment you are working in. This is what I had for you guys for now. If you still have other questions, don't worry, just put them in the comment section. I'll attend to them. I know I'll get some time to sit down and talk about those questions with you guys. I also have another question which involves the myths and misconceptions around the nursing training and the nursing itself, as a nursing profession itself. I I don't think I'll answer that question in this video. It's a it's a question that involves a lot of information. I think I will have to do another video concerning this. So if you want to hear more about that, please make sure that you watch my next sit down video. I will let you know, guys, when that video is coming, so that you know, guys, when you get into this, you need to have clear picture of what you are getting yourself into before you engage, before you get yourself into this unique profession. Anyway, I love nursing. Besides all this, I love nursing. You know that I love it. Not myself only, any other nurse, they love nursing. Yeah, so guys, thank you so much for watching. I hope you guys, you are going to benefit from this video, and I'll see you guys in the next video. Bye. Woo!
Hey, you couldn't see it coming. You might have thought